the brow plays a very critical role in what upper eyelids look like. And so when I'm looking at any patient's eyelids, I'm automatically evaluating their brow position. And so some patients are surprised that I bring that into the conversation, and others are totally expecting it. Because where the brow sits on the forehead has a lot to do with how much extra skin there is on the upper lid. And often patients will come in, and they'll go, I need my eyelids done. Well, if they're holding their brows up halfway up their forehead, I know automatically that really a brow lift is going to be part of the equation. And it's the patient that walks in pulling out the skin from their eyelids saying, I need my eyelids done. Well, that patient needs their eyelids done. So when does the brow lift play a role? When the face is relaxed and the brow is sitting low along the center as well as out along the orbital rim, it can add a lot of weight to the upper lid. And so I'm automatically looking at that with every consultation. There are several ways to address a brow lift. One is the most popular, which is the endoscopic approach. Involves 5 very small incisions in the hair. We don't shave the hair. We don't cut the hair. The hairline shifts minimally. And through those 5 incisions, we can achieve a nice lift of the forehead. The other approach is the more traditional approach, which involves a much larger incision, and that approach I will use for patients with a naturally high forehead when they're beginning, before the surgery starts. If that hairline is very high, then to do an endoscopic approach is not going to be effective, or it's going to make that hairline go way high. And it's that very high hairline that will often attribute to a deer in the headlights look that patients are afraid of. So that also becomes part of the conversation in terms of why patients will not end up with that result in this office.